think we're getting to close to some good numbers, so we'll go ahead and get started. My name is Harun Habib. I'm the Forecasting Healthy Futures Program Director. We're excited to host this webinar with you all to discuss how we leverage technological advancements in climate health forecasting, pathways to adaptation, resilience, and sustainable financing. Before we start, some kind of, Zoom characteristics, please save your questions till the end of the webinar. Also, if those questions, we'll have a chat box at the end for the Q&A as well, and we'll open up the Q&A. In the meantime, also in the chat, if you'd like, you can also state your name and the organization that you're with in the chat. So that'll be great as well. I'd love to give a few remarks on what Forecasting Healthy Futures is and what we do. Forecasting Healthy Futures is an initiative from Malaria No More. We're a coalition of leaders in the technology and health sectors, building awareness of the impact of climate change on human health and advocating for increased investment in proactive technology-enabled global health solutions. We are champions for the experts who drive technology and innovation, and for the donors and thought leaders who integrate climate solutions in public health systems worldwide. We're working through policy and advocacy to really push the climate health agenda and elevate thought leadership around the climate health agenda, and working to help countries build climate resilient health systems. So with that said, I'd like to now turn it over to our esteemed panelists and our moderator, Dr. Irene Torres, to begin this webinar discussion. Thank you.
Thank you so much for that, and thanks for everybody joining today. I'm going to first introduce our stellar panelists. Justin Lana, Technical Advisor of the Clinton Health Access Initiative. Dr. Justin Lana is an experienced technical advisor with a demonstrated history of working towards disease elimination in South Sudan and Central America. He's also currently the co-investigator and implementation partner for the NASA project Getting to Zero, satellite-informed system to eliminate malaria in the Americas, which has the goal of developing tools that can predict malaria outbreaks in communities in elimination settings. He has also been a frequent contributor to the American Society of Tropical Medicine and Hygiene, presenting on topics such as technical support for malaria surveillance and decision-making by national malaria control programs towards regional elimination of malaria in Central America. Here with us today is also Emilia Carrera, the director of the health team at the Rockefeller Foundation. Emilia is a public health leader with experience managing portfolios of partners on implementation of country-led efforts in low and middle-income countries, including in East and Southern Africa, Latin America, and the Caribbean. She currently leads the Climate and Health Program for Latin America at Rockefeller Foundation and formerly served as a director for the Global Vaccination Initiative. She joined the Rockefeller Foundation in 2019 when she started as part of the Equity and Economic Opportunity team, serving as the relationship and grant manager to catalyze public and private sector investments in U.S. cities and support BIPOC populations achieve economic stability. Prior to joining the foundation, Emilia served as a senior program manager for the 100 Resilient Cities Initiative, where she managed delivery of a resilience program in more than 10 cities across Latin America and the Caribbean, Europe, and the U.S. She received her Master of Public Health from Columbia University's Mailman School of Public Health and her bachelor's in biology from the University of Chicago. And last but not least, Daniel Buss, Unit Chief of the Climate Change and Environment Determinants of Health Unit at Pan American Health Organization, PAHO. Dr. Daniel Buss is the Unit Chief, and he has also advised on the implementation of the Sustainable Development Goals, the 2030 Agenda. With a background in ecology and public health, and being a natural of Brazil, he represented his country's Ministry of Health in several international meetings with topics covering the Sustainable Development Goals, climate and health, environmental indicators, and the connections between health and the environment. He was one of the leading authors of the book, Connecting Global Priorities, Biodiversity, and Human Health, a State of Knowledge Review, by the WHO, and CBD. Daniel joined PAHO as staff in 2016, so he has lots of experience. Thank you again for joining us today. And before we begin with the questions, I want to make a small statement to frame the panel of today. The inmate cross-sectoral nature of the risks of and responses to climate change in health requires systems-based approaches that include partnerships, coordination, collaboration, and leadership between and within different sectors and types of organizations. Technology can play a critical role in decision-making, planning, coordination, and many aspects of climate-related risk mitigation and adaptation. Thus, leveraging technology is critical to building climate-resilient health systems. To begin with our first question for Justin Lana, what role does spatial analysis and early warning systems play in understanding the risk of climate-sensitive diseases? We ask you to please draw on your experience in South Sudan and Central America on disease eradication. Go ahead, Justin. Thank you.
Yeah, no, thank you, Irene. Can you hear me okay? My internet's been a little bit shaky. There's a lightning storm in Panama. Great. So spatial analyses are key to understanding drivers of transmission, I'd say especially for infectious diseases. And if we do a good job with spatial analytics, we can do a better job of placing interventions and reducing transmission of diseases when and where we want to reduce them. Early warning systems, to the extent in which they may exist for particular diseases, will almost certainly leverage key spatial information about the relationships between space and then the who, when, where, and why diseases are transmitted. And so in order to predict diseases in the future, we first have to have a strong understanding of what's happening in the past. And this past is what I think about when I first think of spatial analytics. And then the future is what I'm thinking about when I think about like early warning systems. But understanding the past to predict the future, you need a bit more than just what are the drivers of disease. You're also going to need frequently updated information so you can continue to produce your predictions going forward. And then a key assumption of any early warning system based on spatial analytics and our drivers of disease transmission, our understanding of those, is that these key predictors between the infection and what's driving the infection are going to stay fairly constant over time. So I've spent a few years, 10 years ago in South Sudan doing guinea worm eradication. And now I'm here in Panama for the past almost 5 years doing malaria elimination in Central America. And there's two very different diseases. And I'll give a quick example of each of why one maybe isn't that well suited for an early warning system, but where spatial analytics plays a key role in almost eradicating the disease. And then we have malaria, on the other hand, who I think is quite primed for an early warning system and for malaria control programs to actually leverage the information they can provide. But very briefly, right? So this year alone, there's been less than 10 guinea worm cases worldwide. And even when I was in South Sudan in 2013, there was over 1,000 cases in the country alone. But we had a very, very strong understanding of who had the disease, what water sources were around their house. Those were all mapped. And there was a very robust system in place to follow every infected individual month after month after month for about a full year, because that's how long it takes for an infected person to be infectious to other people. And so even just right there, with guinea worm, even if there were cases that weren't contained and maybe it infected other people, you had a full 12 months in order to prepare a response to that infection. Switching over to malaria, you might have 2 to 3 months before an outbreak goes from small to really big. The teams aren't as big in malaria right now. So there was a lot of money put into guinea worm because it was in its final stages. I would argue with malaria, we're still doing a lot of central level planning and decision making in order to get resources to the right places at the right time. And so the benefits of an early warning system are going to be quite high for malaria when you don't have as much time to be prepared for the disease. But I would say the biggest difference, and maybe most relevant for your question, is that malaria is strongly driven by vector behavior and vector densities, and those are strongly correlated with various climate variables and fluctuations. So sea surface temperature, rainfall, humidity, soil moisture. And so if you have a disease that's that responsive to some of these climate variables, you have a really good system, you have a really good opportunity to leverage that information in order to start developing an early warning system. And then if the country's ready for it and the decision mechanisms are in place, you have a good feedback mechanism about what's happening in the future and how to prepare a country for the upcoming cases.
Thank you. Now, to follow up, you are mentioning technology, but you're saying, well, the countries need to be prepared. How can technology in countries that may not be at the same level of others using technology, how can technology augment current strategies and risk prediction and the early warning of vector-borne diseases?
I think I got most of that question. So technology can help a lot, and countries have to be in a position to be able to use some of these technologies. So I would start with, first and foremost, just from my experience here at CHAI, the first thing we do when we work with a country and start supporting them is to build their surveillance systems or strengthen their existing surveillance systems so that we have a good understanding of where diseases are occurring, maybe where testing is occurring, and how well interventions are in place. And that can be done on paper, that can be done with electronic systems, but without a strong understanding of the actual disease dynamics, it's going to be really hard to leverage other additional technologies for some sort of an early warning system. Recently, we brought a project funded by NASA and with colleagues at IAI and Duke and Johns Hopkins. We're trying to implement an early warning system for malaria here in Panama. And part of the reasons we chose Panama and Honduras, I should say, are because they have these electronic surveillance systems that have very little lag time between someone's being infected and testing positive to when they end up in the system. And so maybe not the sexiest technology in the world, but that electronic surveillance system has set the foundation so that we can then combine that relatively near real-time information on cases and testing with daily or hourly or weekly estimates, again, of rainfall, soil surface temperature, humidity, et cetera, those technological things that are coming from satellites or weather stations and continually uploaded into the cloud. Now, beyond those two things, I mean, there's one other thing that we're really benefiting from now that wouldn't have been possible 15, 10, 20 years ago, and that's stronger computing power to process all that data, and then a better understanding of how to implement, AI or machine learning techniques to maybe start seeing connections that we wouldn't either have the time, the data capacity, and or have thought about previously. And so with those stronger connections, you might not even actually fully understand with machine learning what you're picking up on with the historical data and predicting out into the future. But there's a whole world of new data processing that exists that I think, again, is built on the foundation that the countries have built with surveillance that will allow us to start implementing much stronger prediction systems going forward.
Thank you so much.
Thank you.
Now, for our next panelist, we have clarity on what technology is needed and what technology is useful today. But now to be able to finance climate change adaptation, how the existing mechanisms can support countries for enhanced resilience. This is a question for Emilia.
Thank you so much, and thank you so much for the invitation. So I think maybe we should start, and from our perspective at the Rockefeller Foundation, we believe that the climate crisis is going to be measured in human life and livelihoods. So as we think about how can we finance the three aspects that I see at the intersection of climate and health, one, how do we address the direct health impacts of climate change? How do we strengthen climate resilience and environmental sustainability of health systems? And then how do we promote and fund health co-benefits in climate change mitigation and adaptation? I would say that finance in philanthropy particularly can provide risk capital to test innovate solutions, incentivize others to come in or to invest in some of these solutions. Philanthropic capital can be catalytic at taking a first loss as organizations are testing and advancing their R&D. Financing can also come in handy in helping R&D until the idea becomes investable. I think one particular piece for Latin America and the Caribbean is we looked at the climate and policy initiative analysis when we saw that in Latin America, almost half and half of funding for climate comes from private and public financing. And I think there's still a debate of whether that should be more public or whether that should be more private. But I think climate financing and philanthropic financing can help unlock some of these resources or mechanisms to enable more solutions and enable more funding, either public or private. I think also that knowing that 0.5% of climate financing goes towards health, I think there's a huge opportunity for us to fill that gap between what we're seeing that countries are prioritizing. So we're seeing that 90% of countries are prioritizing health in their nationally determined contributions. But then we only see that 0.5 climate financing allocated for health initiatives. And so here we see that opportunity to close that gap and to identify not only what is already prioritized for health actions, but I think also we need to understand what is that robust pipeline, and is that pipeline, does it have an indication of cost? Are there ways to measure? Are there solutions that communities have already identified and we just need to listen and scale them up? I also think that we need to have a common vision around what climate and health is, and how are we measuring, how are we accounting for it. And the third, I would say, bringing on this catalytic capital to unlock other country or private investments.
Thank you for that. Now to follow up, what do you think are the biggest challenges for climate finance coming from a philanthropic organization? What is your view?
I think the climate and health financing is fragmented. There's no consensus on how to measure and report climate finance. Sometimes there are health initiatives or health solutions that are not necessarily labeled as climate. And on the other side, I think there is also climate solutions that are not necessarily labeled health. I'm thinking maybe immediately malaria. Are we tagging, what would a malaria solution have to have in order to be a climate and health initiative? I also think there are gaps in data. And I think it's difficult to trace how much are we invested in this space. I think we've noted also that there are limitations and there's a shortfall in climate finance, but then again, it's really difficult to determine exactly how much, because people are tagging it or are identifying it differently. And finally, I would say there's a need to have this common vision around how are we going to finance climate and health solutions. And so at the Rockefeller Foundation, from the health team, we got together with the COP28 presidency, the Green Climate Fund, the Global Fund, WHO, and the Rockefeller Foundation to put together a set of climate and health financing principles. And with this endorsement, we think that we can drive organizations and other partners that are interested in financing climate and health, or are interested in learning about climate and health. And ahead of COP28 that's coming later this month, bringing together these partners and endorsing a set of principles. I'm not going to go through all of them because there are 10, but some of them highlight the need to support priorities that are most impacted in countries, the need to promote inclusive and an equitable approach to financing climate and health solutions, listening to what communities need and civil society partners have developed, alignment with country priorities, mobilizing different types of financing mechanisms, ensuring that the disbursement is efficient and effective, ensuring that the disbursement doesn't take years for partners or countries to receive. So some of those are the principles that we're putting together.
Thank you so much. I'm sure that people in the audience have questions about the principles, and we will have a follow-up about COP28, which you just mentioned, with Daniel. Daniel, a question for you. The next COP will have for the first time a day dedicated to health. What can we expect from that? What are the opportunities of connecting climate and health?
Thank you, Irene. Thank you, colleagues, and thank you, Forecasting Healthy Futures, for the invitation. It's true. I mean, we are at COP28, right? So 28 sessions, 28 events. And this is the first one that we have a health dedicated day and sessions. So that tells a lot, excuse me, on how much this is a priority. But at the same time, we can see that now that the time has come, we need to be ready also to take action on climate change and health. So it's good that this is picking up. So December 3rd is going to be this health dedicated day at the COP in Dubai. We are hoping to have over 50 ministers of health from around the globe attending this session. We have countries are preparing a declaration on climate change and health. And we're going to have dedicated sessions and discussions held at that COP. On top of that, these whole movements are feeding into WHO, World Health Organization, and PAHO, the regional office of the WHO for the Americas, to be reflected in a WHA resolution, the World Health Assembly resolution, a global plan of work and resolution on climate change and health. Many countries are writing this proposal right now, and we hope that it's approved in May next year. And the next big movement will be here at PAHO in September, where we are having a policy on strengthening health sector's actions on climate change and equity, to touch on some of the elements that you are raising and that Emilia referred to as well. So making sure that we understand who are the most affected persons by climate change. We understand that climate change is going to affect everyone, but not with the same power, not with the same impacts. So we need to understand who is going to be affected the most to be able to respond quickly, anticipate, prevent, respond, and quickly recover from climate-related events, not just disasters, but long-term changes as well. I think that a lot of the attention of the world on climate change and health will be focused in the Americas in the next 3 years, starting now, even before the COP, where Brazil starts its presidency for the G20, and Brazil has already announced that climate change is going to be one of the 3 priority topics for the G20 discussions. And also Brazil is hosting COP30 in 2025. So bringing the attention to this part of the world, the United States is also very much pushing this agenda forward, as well as Canada and many other Latin American, Caribbean countries that are going to attend this COP. We hope to have around 15 ministers of health from the Americas attending this next COP. And we are hoping to have a very powerful dialogue with concrete deliverables and a concrete work plan drafted from this declaration and discussions to be able to move forward with the early warning systems, with the healthcare infrastructure, with the training of healthcare professionals, and the health co-benefits, meaning the understanding what are the impacts of activities that are taken outside of the health sector, also can provide health indicators and health benefits. And we are here at PAHO delivering a number of activities with countries to measure those impacts, including the health economic impacts of avoided costs in hospitalizations. For example, if a country implements everything that they're committing in their nationally determined contributions, or other plans and activities such as green spaces, active transportation, changing the energy matrix, focusing on locally food production and healthier lifestyles, plus the whole infrastructure of healthcare facilities and service delivery. So it's very important that we are together on this, and I echo my colleagues in this important call that we're making for all hands on deck for health and climate change.
Thank you, Daniel. Now, to follow up, PAHO has an important presence in the region, and the data it collects and analyzes and the frameworks it drafts in consensus with the countries are extremely important to governments. But what would the specific needs of the health sector be so they can trigger action by governments and their partners, and also organizations that fund or would fund potentially resilience in the health system?
No, thank you, Irene, for the question. We've been hearing, I mean, Justin was mentioning the importance of early warning systems, for example, and they are key, right, to identify way in advance, potentially. I mean, sometimes these early warning systems have a very high certainty closer to the events themselves. Like a heat wave, we can predict, like with a high level of certainty, 5 to 7 days ahead of time. If you don't have all moving parts that are needed to respond to the heat wave, then the warnings, if they're not triggering early action, they do no good. So what do we really need to understand? And that question is very important because we see health as a user of those early warning systems. And as a user of early warning systems, it's incredible how many moving parts it will trigger within health sector. But this is the invisible hand of health operating once a warning is issued. And let me give you just one example. So for example, if you have, and we are doing that, for example, in Argentina and other countries with dengue. So trying to understand, even way in advance, but also outbreaks in the short term of dengue. And particularly, we're working in the northern Patagonia, in Neuquén, in this province, where for the first time in 18 years of entomological surveillance, we found that for 12 consecutive weeks, Aedes aegypti mosquito was able to complete its cycle there. That gave us a very clear threshold of temperature that the mosquito is able to complete its cycle, and to this day, Aedes aegypti is not found in these provinces. They come by planes, they come by trains or buses, in transportation modes with people. But now it looks like it's getting closer and closer to being able to establish itself in these parts of the globe. That doesn't mean, like Justin was saying, to immediately translating into disease, but it is an indication, right, of suitability, of feasibility, of or possibility of happening. And what I want to call your attention to is that those early warning systems, for example, will trigger within health the need for improvements in lab capacity to identify the viruses that are circulating that, to identify the susceptibility of the mosquito to insecticides to control the mosquito populations. In monitoring, you need to have epidemiological surveillance, you need to have entomological surveillance in place And even we are expanding in 2 months the entomological surveillance in those areas, not only in Argentina, but in Chile, but also in other parts of the globe, in order to identify way in advance if there are changes in the population trends. Plus, we need to train healthcare professionals who are not used to identify the symptoms of dengue in those provinces, for example, or provide training for the general population on risk communication. So this is the invisible, plus the vaccines, right? I don't want to forget about that, plus development of medications and vaccines. But the thing is, this is the invisible hand of health operating to prevent an outbreak. And we can only remember health when there is an outbreak. But the efforts that health is doing behind the scenes is amazing, and that has to be recognized. We saw the effects of not being able to respond adequately to COVID, SARS-CoV-2, for example, and how that triggered in the world. So we need to strengthen health sector and health sector response, like I said, in this invisible hand of health, all these actions to be able to prevent those things from happening. That's the best way of operating, not responding to an event, but preventing those events. So that's where I wanted to call the attention to. As a user, and since we're here in this discussion of forecasting healthy futures, I mean, this is key. This is key to be able to prevent, but not only forecast is important, but also early response. So if we can really work in tandem by identifying early and triggering action and making sure that investments are going to the right place to prevent those events from happening, we will be doing a good job in delivering healthier indicators for the population.
Thank you, Daniel. Thank you all for this incredible insight in each of your topics of expertise. We're going to finish this round of panel interventions before we go into the questions from the audience. Yes. First, for Justin Lana, what one action can be taken from your particular vantage point that could potentially move the needle forward in helping to address the climate change and health crisis?
Good question. Climate change is here, right? We're living the realities every single day. Some places are more affected than others, of course, but it's here. We know the science and technology is rapidly advancing. That's either going to allow us to do a better job at disease prediction or just having a stronger understanding of how and why certain climate things are going to be affecting the disease dynamics on the ground. I think my fear or my call to action is that we as a scientific and global health community, I think Chaya is quite well positioned to lead on this front as we work directly hand in hand with ministries to support their goals, is to ensure that any early warning system or any new information that's coming out about how climate will affect health is able to be absorbed and used by the ministries of health, right? We have to make sure that they have the capacities to leverage the best available systems and knowledge. And so specific action, I don't know if I have one, but I definitely would say that for every $2 that goes into advancing the science, we need to have an eye on how much money goes into the folks that are going to need to be able to absorb the scientific knowledge and actually make the decisions for the populations in which they serve. So my call to action is just not losing sight of the end users as the science and technology advance in the face of the different climate uncertainties that we have.
Thank you, Justin. I would have liked for you to define who are the end users for you, but we still have the round of questions and answers for you to give us further insight. Emilia, the same question for you. What one action can be taken from your particular vantage point that could potentially move the needle forward in helping to address the climate change and health crisis?
From a financing perspective, I think we need to know what is needed, what are the challenges, before we create or finance solutions. And what is needed, we may already have those solutions, and communities and countries may already have those solutions. How do we elevate those? How do we ensure that those have a cost attached to them, so that when the funders come, they know what is expected or what is needed? I think also there are efforts in countries, and I'm thinking, for example, the national adaptation plans that are happening for health sector that are happening in countries, or some of those, some of the climate adaptation strategies that some cities have, or some other plans that cities, subnational sectors or national sectors have developed that identify what is needed. But I think we need to take a step further and identify then what is the pipeline of solutions and what is the cost for them, and ensure that is measured.
Thank you, Emilia, for that. I'm sure the Inter-American Institute for Global Change Research would like to partner with Rockefeller Foundation to, at least in our region, help to link governments with you, so you can start compiling evidence and information on these solutions and the costs. And as Daniel also mentioned, PAHO is providing already data on the costs of the impacts in the health sector, the impacts of climate change in the health sector. Now, Daniel, for you, the same question. What one action would move the needle towards moving forward to address the health and climate change crisis?
Well, it's unfair to ask for one action, but first let me echo a little bit of what my colleague said, because I agree with what they suggested. Emilia also articulated on the HNAPs, the plans and everything, and I think that's key to make sure that health has a role to play. But I think that we know enough to take action, right? We don't need, of course, it's always important to gather more information and to understand the connections, but countries have already flagged their priorities very clearly. And we do have an IAI and PAHO, we have been partnering for a long time now on understanding what are the capacities and what are the tools that are available. So scaling up the use of these tools, scaling up the use of successful stories and interventions is a way that we should be spending more time and focus on. We do know enough to take action. We do know enough of, we do have enough successful cases everywhere, on investments in infrastructure, investments in early warning systems, or training healthcare professionals, or understanding the connections in co-benefits. So we know enough. What we need to do is to start really pushing a program of work that is tailored to the country's needs, to the communities in need, and just merging. And that's what IAI has been doing, and we ourselves are doing together to see what are the needs versus where are the solutions. So we need to continue on this path. And I see William Pan is here and commenting in the chat. So he has amazing experiences to share as well on community-based answers and solutions. So I think that we do know enough. We do have a lot already that was gathered by so many brilliant minds. And why not just taking those and trying to replicate and adapt and offer to where the situations are similar? I think that we don't need to reinvent the wheel all the time. We should be scaling up what's been successful in some parts of the world or in this region to advance quicker.
Thank you so much for that, Daniel. I'm going to just very briefly summarize the general overview of the panel today, and we would like to invite our audience members to ask questions in our chat. We will address Bill Pan's question in a minute. So bridging technological advancements and in financing mechanisms is definitely essential to drive innovation and scale up solutions. And we have to find pathways for investment into existing technologies, emerging technologies, to ensure that these investments are accessible to countries. But there are challenges in integrating finance mechanisms, and also integrating regulatory environments, community interests, also partnerships that are already in place, either public and private partnerships, and also intergovernmental partnerships. So we would like to think about what strategies are ahead of us, not just for the COP28 meeting in the next month, but for the coming years. And as Daniel mentioned, the COP30 meeting will take place in Brazil, will be extremely important for our region to be prepared, either with the solutions that the Rockefeller Foundation is proposing that we compile, for example, and also think about what local governments with national governments could be able to achieve in the near future. Sometimes we think in terms of national governments because most of us work in intergovernmental organizations, but local governments, as Daniel mentioned, for example, the example of province of Neuquén in Argentina, local governments play a significant role and may not always have access to larger finance mechanisms. Now, to begin with Bill's question, in climate financing, I'm assuming this question is for Emilia, how are funders weighing investments to most vulnerable populations versus infrastructure capable of using external funds to respond to climate issues? And he gives an example. Invested in Panama, where the infrastructure is primed to integrate an early warning system but has low malaria, versus, for example, Myanmar, where the health system is less able to adopt an early warning systems approach, but malaria risk is much higher. So the question is, how funders balance climate sensitivity risk versus the ability to integrate technology for climate? Please, Emilia, go ahead.
Thank you. And also, I'm not going to pretend to answer for every donor and every climate finance institution. So, but I think that the question is a good one, because I think we need to, it's going to depend on the funder, and it's going to depend on the donor or financing mechanism. And it's going to depend on their strategy. So while I agree with, for example, what Justin mentioned, that as we invest in tools and technology, we have to also invest in building capacity, local capacity to adopt that tool or technology. I think it really depends on the strategy of the funder to be in the different life cycle of implementation. So for some, it may be more attractive to invest on a more climate sensitive or higher risk country or area that will require a lot more resources and maybe more attention and resources to implement and to scale that up versus another country. But I think it will depend on the strategy of the funder.
Thank you, Emilia, for that. We don't have more questions in the Q&A or in the chat, so I will pose a question myself. I think we've been a little bit general about how the system would work across the region to help countries work with each other, because we know that diseases travel. Daniel posed that example, dengue traveling to Argentina where it wasn't endemic. But how can the governments really work together if they have systems that are not interoperable? They don't have the same technology. They don't have the same data sets, or they don't work with the same variables. I don't know if, Justin, you work specifically with that. Do you have a more specific suggestion so that governments can work together?
So just for reference, yeah, so I support Panama, Guatemala, Honduras, the Dominican Republic, and Haiti. And as far as I'm aware, none of their systems talk to each other. There are some bilateral meetings occasionally between Panama and Colombia, for example. There's been some recent ones between Nicaragua and Honduras, as there's a lot of movement along the border and probably the most endemic region of part of Central America. So sometimes I will say there are intergovernmental meetings. They're not private per se, but that information or the data systems for like malaria aren't just blasted out on the internet for anybody to be able to see. But I think in a perfect world, a more perfect world, there'd be a key set of variables, maybe at the weekly or monthly scale, at a pretty small admin unit level, where we would at least be able to start to understand what's happening in our neighbor countries. That to me seems doable, be respectful and sensitive to different data systems in the countries, as well as the need for individual privacy, of course, for malaria patients, or even at the maybe perhaps the locality level. But if there were a system in place where all those systems could come together, you might get a bit more crosstalk between countries, because as it stands right now, it's again some bilateral meetings between countries that are likely set up between those countries, probably with the support of PAHO. And then you might be lucky if it's folks at CHAI, for example, who are working in both countries, or academics who have data from both countries, and they're allowed to share that across borders. But I wouldn't say the systems are in place yet where there's a lot of crosstalk between the decision makers, right?
Thank you. Yes, the II is working on harmonizing at least the vector-borne disease surveillance tools, and it's called the Harmonize Project, actually.
It's a great word. I should have used it.
We would actually have a solution there if we can find ways for governments to harmonize their surveillance and early warning systems. And you have just confirmed our fear, is that governments are not working together to do this. I know PAHO has at least one tool to help report in a similar manner across countries to report vector-borne diseases, but we need early warning systems also to talk to each other, as you say. Yep. And well, that would be a concrete solution to work on in the coming years, for sure. Daniel is going to say something because he already knows what's going on. Thank you, Daniel. Go ahead.
No, thanks. No, very quickly, just to add to that, and thanks for the question. But countries have agreements, right? Multi-country agreements through international health regulations. That's how countries are. There's a mandatory, well, not even in quotes, truly mandatory request that countries that are signatory to that to provide information for PAHO and share this information publicly, right? There are channels to do that. There are channels and agreements with countries on which information and how they should be disclosed or not. But we do have all these platforms and all this data that is readily available for anyone that wants to see. The thing is expanding that, making it more agile, and the critical thing, for early, and this is after the fact, right, that the data is reported. What we are talking here is early warnings, which should be understanding in advance a projection to a certain place and then taking action. So there are two different things, right? So after the fact information that should be posted, and we do have this information available for many health affections, included infectious diseases. But now, for example, on heat waves, we are trying to make sure that countries are able to register. A doctor, nurse is able to register that someone entered a clinic or a hospital affected by heat. That doesn't exist. There's not within the codes of disease, for example, in international agreements. So we need to advance much further. So in order to absorb, to incorporate the information of what's going on with the population as an impact to climate change and health. And that's why we have these, I'll do this kind of a, I can show it, yes. So a pocketbook, climate change for health professionals. So here, for example, you have which medications should not be prescribed during a heat wave because it can exacerbate the effects of heat or floods, and this is tailored for health professionals also to identify what are the potential impacts on health of climate change, so they can find where the information would come from. And it's a very complex system where meteorological data, environmental data, social demographic information, and health surveillance systems should meet in a space, in a platform that we are calling observatories on climate and health, to be able to understand in advance or understand what happened. Why did I have in my country or in my city or in my province a surge in cases of something, and if they are or not related with weather and climate? But those systems don't speak to each other yet. So that's something that we are also trying to promote in the Americas.
Thinking of how systems are not speaking to each other, artificial intelligence certainly opens the door to go faster down the road of having systems speaking to each other. But I wonder, because there is concern about artificial intelligence, I wonder if Rockefeller Foundation, thinking of the principles that they're working on, and as a larger organization, are you concerned with artificial intelligence, or are you already supporting the use of artificial intelligence? Is that a pathway that you feel comfortable with and would like to see more of it, actually, to address, in this case, the climate change crisis or emergency?
So I can give an example from the health perspective on how what we've done and how this has come up in our work, how artificial intelligence has come up in our work. And while I think the technology is advancing, I think there's a lot more work that needs to be done. And from the technology needs to advance, and also the understanding of that technology needs to advance. So one example, we are working in Bangalore with a team that's designing an early warning system for dengue. And initially, the team thought they wanted and needed artificial intelligence to predict cases. But as we were going through the data, and the team was going through the data, we started seeing gaps, essential gaps. So essential gaps in the data, data collected in Excel spreadsheets, and one Excel spreadsheet was not talking to another Excel spreadsheet. And so the basics needed to be covered. And once the team had the basics covered and they were able to determine prevalence and incidence, then they were able to start exploring, okay, what logistic regressions can they do? And so now they're in a point where they're starting to think about what could be the use of artificial intelligence with the models that they currently have. So I think it's an exciting moment for all of us to be in. I think there's a lot of investment and development that needs to happen. But I think countries and cities in this case are starting to explore the use of artificial intelligence for early warning systems.
Thank you so much for that real world example. It's very important to learn about, definitely. We don't have any more questions in the chat. I have one final question for each of you. Oh, Justin wants to say something. Go ahead, Justin.
No, I think Dr. Pan added another question.
Oh, he did actually. Sorry, just popped up now. So this is a question for Pajo, Daniel. The majority of data that is shared between countries publicly are not useful for methods used in early warning system. That is, they usually are reported on a monthly time scale, which is not useful for a vector-borne disease system. They're not reported in real time, so the public data are usually reported late. What is PAHO doing to try to get better spatial and temporal resolution data shared more openly between countries?
Yeah, exactly what I was trying to talk. So thank you, William. The one thing is the after the fact where and that those things take time, you know. So if someone dies in a country, sometimes it takes almost a year for this data to be available. Just to give you one example from the real world, you know. So maybe you can say, oh, almost a year ago that happened in that region. But that's, you know, not even close to what we are talking here when we are thinking of early warning systems and everything else, which are focused much more on projections, future projections, right? Not only. So understanding the trends of disease and how those diseases, depending on our health affections, will react to meteorological, environmental fluctuations. That's what we are talking here when we're speaking about the early warning systems. And there's a certain level of uncertainty, of course, related with these projections. And that what sometimes governments, we receive some pushback from governments because they are not willing to take action and to spend time, funds, resources to change their dynamic and their operations if those early warnings are not, you know, issued with a certain level of certainty, and that's very tricky because in our vision we should adopt this no regrets approach, right? Of, you know, if you project that a hurricane is hitting a specific island in the Caribbean and you take all the measures, the protective measures to protect health, and the hurricane makes a turn or it's weaker than it was initially projected, the impression that it gives is that this was a money poorly spent. But if you see from another perspective, where if you don't have those systems in place and you're not ready and a hurricane hits, the devastation can last for decades. And we are talking only about, I mean, the tip of the iceberg, which is a hurricane in an island, but long-term droughts, floods, or the loss of productivity or increasing prices, pushing people to poverty, making people having to be forced, displaced from where they live and migrate or leave to other areas without the health protection, sometimes crossing borders, dangerous places. We saw, I mean, this year, the Darien Gap between Colombia and Panama, we'll see something close to 500,000 people migrating, passing through this forest, which is dangerous, which with women, with children, and they fly below the radar of the health sector because in a way they are invisible. They are poor. So there's a compound effect that hits those persons first. So that's why we are talking about the climate change and equity component, to understand who these people are and what can we do to protect them first. But to respond back to William's comment, we are trying to create, William, as you know, some of the things we have discussed, those very on the ground national observatories, because sometimes, and Justin was sharing some ideas about that, the country's sovereignty of data, then one country sharing with another becomes a little bit more of a challenge. But at least internally, countries issuing those early warnings and developing national response is one of the goals that we have. So we have been advancing with a few countries in the region. We hope now with more funding and more partners to be able to deliver that in more countries than that, than what we are working on.
Thank you, Daniel. A final question for Emilia and Justin. I'm going to take the idea of what you just mentioned between Panama and Colombia, the 500,000 migrants that are, I don't want to use the word, but trapped in the border and are prey to also the impacts of climate change. The question here is, in migration, for example, you see that different UN agencies work together with different funders, different international, local NGOs, international cooperation from governments that are not in the region. It's a very complex web of financing and collaboration. So, Justin, in your area of technology, what kind of collaborations do you see? I only know the migration and health collaborations, but in your area, what kind of collaborations you see that have the potential to again bring us forward in addressing the challenge of climate change and health?
I can
You're
start.
absolutely. Oh yeah, Amelia, you start, please.
Sorry about that. I think we have to also be careful of the unintended consequences of surveillance and you know the how delicate the topic of climate migration and tracking diseases of migrants. So I think we have to be careful of that. But I think there is an opportunity for collaboration between countries that are not necessarily sharing data. I think we talked about data sovereignty. I think that may be that may not be possible. But I think collaboration in terms of action or in terms of sharing potential solutions or coordinating action. So building, I don't know if it's building a network or strengthening communication and collaboration between countries. And we've been talking about climate health observatories, and I think that may be an interesting place to start, is how are these climate health observatories talking to each other across countries? They may not share data, and we understand that, but how are they collaborating and on what they're seeing, and how are they responding to what they're seeing?
Thank you so much. There was mention of the observatory by Daniel, and I think that's an important point. Observatories may be working nationally, and they should also talk with each other. Justin, please.
So from my experience, as I mentioned, I'm at CHAI. Our goal is to be at the service of ministries. And a lot of what we spend our time doing is liaising between the Ministry of Health and different academic groups or drug suppliers or whatever, just to either help move things along, help speed things up, or bring new technology and tools that the ministry may or may not choose to adopt right away. I think it's a very important role that we serve, but I think going forward, when we think about like climate and health and getting countries to talk to one another, in a perfect world, they wouldn't be talking through CHAI and through PAHO to the other country and to PAHO. Ideally, they would have someone on their team funded by their countries to be able to lead those efforts without intermediaries. And if you get people, obviously they would want the support of PAHO or other partners where necessary, but the closer you could get someone to the actual different ministries, their programs, I do think it would speed things up a little bit, and or maybe strengthen those connections just from an organic point of being, right? We want these ministries of health to be standalone entities and to be able to go out and coordinate with whoever they want and have the capacity and time to be able to do so. And I feel like sometimes a lot of the gaps in which we try to fill at CHAI isn't because the ministries aren't capable. It's because they have 17 other diseases. They might be understaffed. And so we're just trying to support them with some time and energy that maybe they don't have available or aren't funded to provide. So, I guess what if I had to put my answer in short, it'd be like we should always be looking back towards the ministries and what can we create for them that's a sustainable solution that doesn't rely on outside partners.
Yeah, it's a paradox. Ministries may need the collaboration of external partners, so solutions are sustainable and financing is sustainable, but they also need to work independently, not rely on these collaborations for solutions to be sustainable. Thank you for that. Well, we're going to wrap up now with some words by Harun Habib, who is the Forecasting Healthy Futures Program Director. Please go ahead. Thank you.
So much, Irene, and thank you all to the panelists. Just a few closing remarks from what I've heard from you all. AI-enabled early warning systems can be used to combat the increase in volatility of climate-sensitive diseases through allowing for better decision-making to mitigate risks. When we fully integrate in public health systems, disease prediction and planning tools, we can really build sustainable climate resilience and create meaningful cost efficiencies by enabling more targeted use of limited resources. So I hope that all the attendees, as we lead up to COP28, which the Health Day on December 3rd, really were able to learn from this session around the broader issues in climate health and really think about the global health solutions that can be applied, specifically early warning systems and so forth. So I hope you all got that through this session. And we hope that you'll join future Forecasting Healthy Futures events as well as we elevate the climate health leadership and dialogue moving forward. So again, I'd like to thank all our panelists, and we look forward to you all joining us on future events. Thank you.